What did you say, Mike?
Well, it was for pain because they said, hey, you don't have a tear in your rotator cuff. And I told them, yeah, I know that. But it was for pain. And anyway, and they did it in my left shoulder.
Did you get any relief from the injection?
Oh, yeah.
Yeah.
A lot. A lot. I'd like to think that, oh, wow, that did it. But I really don't care for needles.
Yeah.
Andy,
Oftentimes, Mike, oftentimes a physician may use a cortisone injection as a diagnostic tool as well as a treatment. They can target the tissue they're injecting around, and that tells them what tissue is inflamed. It may not be a tear in your rotator cuff, but it sounds like you may have some impingement syndrome happening.
I'm no good with those words, man. I don't know what that means.
Basically, you've got a tendonitis in your shoulder, and there's a very high success rate with physical therapy intervention in the treatment of that. It involves some manual techniques, as well as some stretching and some strengthening on your part.
Okay. Well, thanks, Andy.
All right. Good luck.
Yeah.
So, Mike's case and everybody else who might be thinking about physical therapy, how do I bring you into my care? How do I engage you guys?
Well, Indiana is one of 2 states in the union where you have to have a doctor's orders. So when you see your physician for your problem and they diagnose it as something that physical therapy can treat, then that's your prerogative to go wherever you want to. Much like when the doctor prescribes medicine, you can go to any pharmacy you want to fill that. And the biggest thing is to educate the patients is their ability to go anywhere they want to for their therapy. And physicians are educated in physical therapy and can get them to the right physical therapist as well.
Should I feel odd about asking the doctor if this condition is something that physical therapy would address?
Not at all. That's your prerogative. And you should, okay? The smart consumer should do that. They're not, the physician should not get angry with you or think that you're questioning his ability if he doesn't bring that up. May have something that he may not have thought of. I said, yeah, that's a good idea. Or yes, you can try that, and let's try that first.
Physical therapy being conservative in that, should you stop physical therapy, any adverse effect, that's very rare, will subside. You won't have the allergic reactions that you may have with medications, and in the vast majority of cases, we see patients that in their mind are destined for surgery, and in a great number of them are able to avoid it.
Wow. And who wouldn't want to avoid surgery?
Yes.
Let's see what's on Linda's mind tonight. Linda, you go right ahead with your question.
I also have a question about fibromyalgia. I was wondering about massage therapy across my shoulders where I have the real sore points. Everyone says how tight it is, so I wondered what massage therapy would do for that.
Massage therapy would be palliative in nature. It'll give you relief, but it's going to be a temporary relief. You may have some cervical dysfunction going on as well that is making the symptoms in that region of your body become more recurrent in nature, and quite possibly consulting with your physician and a physical therapist can show you specific exercises and in-clinic treatments that will give you a lot of relief.
Help me understand how, thanks Linda, thanks for your call tonight. Help me understand how if I've got an organic condition, a disc that's being impinged and something that's going on that's causing nerve pain, how is exercise and physical therapy going to address that problem?
Well, like I said earlier, one thing that we'll do is we'll look at how you're moving. Okay, a lot of times, often a disc problem, if it's not a traumatic event, is more of a reoccurrence or a overuse type injury. And if you're always doing the same movement over and over again, whether that be at work or at play, then we can address that. And as a result of that, there's muscles and joints that are going to be weak and stiff, and we can, to counteract that, use techniques, joint mobilizations and specific strengthening exercises to decrease that muscle imbalance that's present already in your back.
I often describe those type of things to patients that if you've got a wheel where a bearing's going out, it's just going to cause more and more wear. Where what we're trying to do with physical therapy is we're going to strengthen this muscle, improve the flexibility of this muscle so that joint moves smoothly. We're going to decrease those stresses in the joint so it calms down and you feel better.
Okay. You mentioned joints. Let's go down that path. More and more of us are headed toward a total joint replacement somewhere in our life. We're living longer, and of course the obesity factor also increases the joint stress and strain.
Yes, it does.
So tell me about how physical therapy works in a total joint replacement.
Post-operative care, we can help restore motion. Again, it may sound like a broken record where we're stretching and strengthening. We're also doing manual techniques where we help scar tissue remodel so that your skin, the suture, everything regains its mobility, so that is not restricting the joint motion. And in some cases, we're doing mobilization techniques to help facilitate improved extension of the knee or flexion of the knee so that the person can get enough motion back, not just get enough, but get to the point where they're back to where they want to be, pain-free and functioning, going up and down stairs, getting up and down out of the chair.
And in conjunction with the question earlier about the gal with the rotator cuff, whether or not therapy would help her before surgery, we oftentimes see people before a total joint replacement for education about what they can do now to help strengthen it, to try to get that joint and that body part, or even the whole lower extremity if it's a lower extremity joint, as strong as possible, as good as possible before surgery, so the outcome's going to be better.
Let's get back to the phones. We've got a quick question here from Rick. Rick, what's your question for us tonight?
Yes, I had a car accident back in '72, and the doctors I went to St. Joe, okay, they told me no physical therapy whatsoever. And I was just wondering if I would have had physical therapy back then, I might not be partially paralyzed now.
There's no way of knowing, but I can say physical therapy has evolved greatly in the last 20, 30 years. So.
And back to the point, thanks for your call tonight. Back to the point of Indiana requiring a physician's referral. I'm thinking that's going to be detrimental to the patient. If I have to go to that extra step before I can come and see you guys, am I likely to put that off? It seems as though if I don't have that access that I could have otherwise, I'm not going to be touching your services as soon as I might otherwise be.
It is an extra step. It is what it is in the state of Indiana. We're one of 2 states that do not have some form of direct access to physical therapy. But there would be much less delay in treatment in a lot of cases.
Yeah, we've got to leave it there. The clock's run out on us, guys. I appreciate it. It goes fast, doesn't it?
It does go fast.
Troy Smith and Andy Vogel from Indiana Physical Therapy have been our guests. We hope that you've enjoyed what you've seen here tonight. If you'd like more information, like to get in touch with these guys or their compatriots at one of their 9 locations, you can call 490-4800 or go to indianapt.com. Next week on Docs on Call, David Bojerab from Pain Management Associates is here with us, and we'll be covering a number of topics as he always does, answering your questions in the way that Dave only seems to be able to do. If you'd like to see this program online or tell a friend about it, you can log on to incnow.tv, go to the features page, and then click on Docs on Call. Thanks for joining us. We'll see you next week.